Recovery podcast is real life stories from everyday people in recovery. From mental health issues, trauma, substance misuse, and behavioural addictions. Please visit the website www.lifeinrecovery.co.uk for links to social media and a range of books written by your podcast host, Bren Coy.
Hello and welcome to the Life in Recovery podcast, episode 75. The Life in Recovery podcast is sponsored by Dennis Berry Life Coaching. So Dennis is a certified life coach who's been working with people all over the world for over 15 years. And he can work with anybody, anywhere via Zoom. He's an expert in addiction recovery and life mastery, and he's been clean and sober himself since 2003. And he can help you with your journey through sobriety and help you to achieve inner peace, success, and fulfill your life mission, whatever that may be. If you're sick and tired of being sick and tired and you're ready to make changes in your life, book your first free consultation by visiting www.dennisberry.com and use the code words Life in Recovery to get 10% off your next 3 sessions. The podcast is also sponsored by a former podcast guest and founder of sugaraddiction.com, Michael Collins. That was episode 20. He's helped thousands of addicts get and stay sober since 1985. During that time, his special passion has been to help recovering addicts who've turned to sugar after they got sober. Many recovering addicts struggle with weight gain, diabetes and other health issues that all trace back to an addictive use of sugar. In most cases, quitting sugar is even harder than quitting drugs and alcohol. If you think you might need some help with your sugar addiction, Michael is offering a free copy of his book, The Last Resort Sugar Detox Guide, to all my listeners. Just visit www.sugaraddiction.com/lifeinrecovery and download your free copy. And if you're really serious, check out his 30-day Sugar Freedom Challenge whilst you are there. The podcast is also sponsored by the Recovery Coach Training Academy from Helios Recovery. And this is for anyone who's interested in becoming a recovery coach. So recovery coaching is a form of strength-based, healing-centered support for persons in or seeking recovery from substance or behavioural addictions. Similar to life and business coaching, recovery coaching is a type of partnership where the person in or seeking recovery self-directs their recovery, while the coach provides their expertise in supporting successful change. Recovery coaching focuses on achieving any goals that are important to the individual. Helios Recovery Service is offering a digital recovery coach academy and ethics training on January the 25th to January the 30th, 2021. This training includes core competencies for recovery coaches with additional training on ethics, boundaries, medication-assisted treatment, gambling and more. Recognised as the original and leading recovery offering of its kind, the Recovery Coach Academy is a pioneering new approach to healing people's lives that is unlike any other training. Visit www.heliosrecovery.com and when you register, use the code words Life in Recovery to get 10% off the package price. Please don't forget that you can financially support the podcast if you're feeling generous. Go to www.patreon.com/Life in Recovery, and there's a few different packages to choose from there. I enjoy making the avatars for my Patreon supporters, and also if you want to dig deep, you can also appear on the podcast yourself. So check that out, patreon.com/Life in Recovery. Happy New Year. I hope you're doing well. I hope you enjoyed Christmas, wherever you are in the world. Mine was lovely. I had a really relaxed Christmas with my family, and it was probably the most enjoyable Christmas that I've had in my adult life, I think. I think especially because it was my daughter's first birthday. And it was just, I think being in lockdown in some kind of weird way made it less pressurized. And I often don't really get that excited about Christmas. But this year, I kind of went with it, got into the Christmas spirit. I heard my sponsor had been told by his sponsor to do something different this year, which really resonated with me because often I don't really get into the Christmas spirit. So I did something different this year, and I did get into it, and yeah, and I really enjoyed it. So I hope you did too. And if you didn't, it's over and done with now, and it's a new year, and this is the first podcast of the new year. And my guest today is somebody slightly different than normal. He is the CEO and founder of Prime Psychiatry. He is a psychiatrist who actually trained in Birmingham in the UK, which is where I live right now. And he's fondly referred to by his patients as Dr. Air. His name is Efosa Airuhia. He's a passionate and empathic physician who believes in a holistic and evidence-based approach to treatment. So he's very, very knowledgeable when it comes to general psychiatry and child and adolescent psychiatry and addiction medicine and lifestyle medicine as well. It was a really, really fascinating and interesting delve into, the intricacies of addiction and also the solutions to addiction. So I hope that you enjoy listening to this conversation with Dr. Air as much as I enjoyed speaking with him.
Well, first, I'd like to say thank you, Ren, for inviting me over to your show. I'm really excited about this. I'm currently based in Dallas, Texas, but I'll give you a quick background in terms of where I'm from. Several years ago, I worked in an inpatient behavioral health unit where we treated a lot of kids who had gone through a lot of trauma, and we're trying to get them back to functioning properly. And I recall on this one day, I spoke with a kid, and just as he was leaving, he had a few other kids right outside the office, and I overheard them talking about the discussion we just had, and they'd asked him how the meeting with me went, and he said, well, the meeting was nice, it went well. He asked me a lot of questions about how I was doing and what had happened in the past, but he sounds different. And I heard one of the kids say, yes, he does. I think he's from Mexico. And then another kid very confidently said, no, I think he's from France. And then yet a third kid said, no, I think he's from Iceland. That cracked me up so much. And no, I'm not from any of those beautiful countries. I'm from Nigeria, born and bred in Nigeria, went to med school in Nigeria, and then I moved to the UK in 2004. I lived in Birmingham for about 4 years, and then moved down to the United States in 2008.
That's where I live now. I live in Birmingham right now.
Oh, there you go. There you go. Small world, isn't it? Small world, right?
Yeah, so you moved to the States.
Yeah, so I moved to the States in 2008. I lived in Missouri for a while and then moved down to Texas, Dallas, Texas, where I've been for the last 5 years now.
Okay, cool. And so when you moved to Texas, what was kind of what were you specializing?
So starting out from Birmingham, where you currently are right now, Ren, I actually started out with my psychiatry training over there, and then moved down to the United States and also continued with my psychiatry training and got some certifications in psychiatry, child and adolescent psychiatry, addiction medicine, as well as lifestyle medicine. So as much as I have all of the certifications, my passion has always been addiction, and that's for many reasons. I'll preface that with a story, which and this is about a patient whom I treated several years ago. Now, this was a 34-year-old man who had come to the ER at the time because he was really struggling and had actually made an attempt to take his life. He had taken an overdose of medications in addition to alcohol. Came into the ER, long history of alcohol use. In fact, as a result of his drinking, he had lost his job, his marriage, developed a liver disease, had ongoing legal issues. So really struggling with alcohol addiction. So I'd seen him just after he tried to kill himself. He was 34 years old at the time. And I remember this clearly because I was also 34 years old at the time. His son had also just turned 3 years a month prior to my interaction with him. I also had a son who was 3 years old at the time. So, in a sense, I could relate to this patient in terms of milestones.
Yeah.
My son is now 13 years old, and this man's son would have been 13 as well. But his son died in a vehicle accident a few days after his birthday. And this
Oh.
patient was driving. He was intoxicated on alcohol and drugs at the time.
Yeah.
And, Ren, I'd just never seen a man so broken. The positive thing, though, is over the next several months, we're able to work with him, put together a proper plan as well as a follow-up aftercare plan to get him back to functioning a lot better. He was able to pick up the pieces in his life, live a better life in recovery. And for me, just knowing that I can contribute my token in my own very small way to help people like that come from nothing to something, I think it's priceless. So it's stories like this and many more that have always intrigued me about being in the field of addiction. Of course, we'll also talk about destigmatization, right? We know how huge the stigma with addiction is. And it's all about every one of us, just like you are doing right now, Ren, and everyone else who's coming out there to talk about addiction, to bring out the stories, to give hope, to give inspiration to people who are struggling, and to make the general public aware of how much of a struggle this is, and also let them know that this is something that applies to everybody.
Yeah, that's interesting that you say that. So, what's your kind of explanation or take on what exactly addiction is? Do you see it as an illness, or how do you view it?
So I look at the medical model for addiction, and when it comes to addiction as a whole, I know that this is, that there are different facets to this, and there are different ways people look at addiction. Personally, I look at addiction via the medical model. I think addiction is a brain disease. It's a chronic illness, and usually will manifest with compulsive substance use, or in some cases, compulsive behaviors, and this continues to happen despite the harmful consequences that come with it. In fact, people who end up being addicted to whether it's alcohol or drugs usually will have an intense focus on using that substance to the point that it takes over your life essentially. And you keep using even when you know it's going to cause problems.
Yeah, yeah. So, when you say a brain disease, is that something that a person is born with, or a person develops, or does it vary?
So when it comes to the causes of addiction, I like to look at addiction as one of those virgin areas that still needs a lot of research and a lot of studies for us to know exactly what's going on and what causes addiction. So my take is no one singular factor can predict if a person will become addicted to drugs. We have to understand that no one wakes up and says, yes, I'm going to become addicted to drugs or alcohol, but it does happen. And I think it's because of a combination of several factors that influence the risk for addiction. And the more risk factors a person has, the greater the chance that taking drugs can lead to addiction. For me, the number one factor I look at on my list is trauma. And trauma could be emotional, it could be physical. We could be talking about sexual trauma, neglect, or just adverse childhood experiences. There's also genetics as well. We've seen that when a family member, if your mom or dad or grandparents have a history of addiction, whether it's alcohol or to drugs, chances of you developing addiction are higher because these genes unfortunately trickle down. We're also talking about environment. We know that a lot of people end up using drugs or alcohol as a result of peer pressure, as a result of early exposure to drugs, as a result of, in some cases, just the stressful environment. And then another thing, which I really would like to point out as well, which we have to take cognizance of, is mental disorders. We hear every day how people try to treat their mental disorders with substances. I have a lot of patients who have ADHD, didn't realize they were struggling with ADHD, and will end up trying to use meth to self-medicate themselves just so they can focus. We have people who have anxiety, who have depression, who will drink to curb the anxiety and to curb the depression. So with mental health and addiction, it's like a chicken and egg situation. And I
Yeah.
think that's something we have to make sure we explore. So going back to your question, it's trauma, genetics, environment, mental disorders, and the way all of this interplay with themselves. And the more of these any one person has, the more likely it is that they'll develop an addiction.
So really, anybody is susceptible to addiction when you put it that way. I mean, which is interesting because it's something that I've spoken about for the past kind of 5 or 6 years, and that was after I got into recovery and I started to kind of do some more research on addiction, and obviously as my recovery was progressing, I was learning more about addiction, not just alcoholism, because I'm an alcoholic and other addictions as well. And then I started working in a prison as a drug and alcohol counsellor, and I was working with loads of young men, and hearing story after story after story. And that was when I started to formulate this opinion that actually anybody is susceptible to it, providing that they've
That's
got
right.
certain ingredients, i.e., a bit of trauma, which is subjective essentially, and other things that have happened to them. If a person goes through, let's say, for example, a bereavement, and they haven't got the tools to deal with it, and they start drinking or using drugs, they can quite easily become reliant on that substance or the behaviour. So that makes total sense to me. And I think that this is, generally in the world, I think more and more people need to be made aware that they are susceptible to addiction at any time. Is that fair to say?
Oh, definitely. I think you just hit the nail on the head there, and you talked about the fact that it can be anybody, and that's something we all need to be cognizant of. Um, when it comes to people who could become addicted to drugs or who are currently addicted to drugs. It could be your boss at work, the CEO of a big company who's married with 3 kids but addicted to cocaine. It could be the nurse who treated you in clinic last week who has an addiction to pain pills. It could be your neighbor, a stay-at-home mom who will forget to pick her kids after passing out on alcohol and benzodiazepines. The babysitter with a meth addiction, the clergyman with compulsive masturbation, a college kid who's abusing his Adderall. In fact, a few months ago, I treated a patient who told me she had spent $40,000 on stem cell treatment. Now, this is a woman who had come to a clinic for help. She was an attorney, who was married with 3 kids, long history of depression and anxiety, and had been abusing opioid pain medications. Now, Ren, the reason she came to us was because she was just sick and tired of taking so many pain medications, which were no longer working. So, how did she get on pain medications? Well, she had a long history of chronic pain as a child, and she had talked about how she would sometimes sleep in a bathtub with water just to get some relief from the pain. She was later diagnosed with a medical condition called ankylosing spondylitis. And that was how addiction started. She got into the pain pills which were prescribed, ended up needing to take more and more, ended up becoming dependent on them and abusing them, up to the point where she became so frustrated with her life that she had even been considering taking her life just to stop the pain. So when we talk about people who struggle with addiction, it's not the homeless man in the alley who's walking around with a brown paper bag with alcohol in it, or the homeless man who's shooting heroin, Ivy. No, it's fathers and mothers and sons, daughters, colleagues, friends around us. So I think we all need to come together to help people who are struggling with addiction as much as we can. And until we all come together to help, it's gonna remain a problem, sadly.
So what do you believe as a medical professional? What do you believe is the actual solution to addiction?
Oh, wow. Ren, I wish I could say I had a magic elixir or a silver bullet that will just take care of addiction as it comes. I don't. But here's why I know, though. Treatment, addiction treatment, one, has to be individualized. It has to be personalized. No two people are the same. So 12 steps, for instance, the traditional model has worked great for a lot of people. I'm a believer in it. It works. I have people, a lot of patients and friends who have recovered from the 12 steps and swear by it. So that's a modality of treatment. In addition to that, I also believe in the other modalities of treatment out there, whether it's medication assisted treatment to help people who are struggling with their cravings, whether it's harm reduction. My view to this is the more options we have, the more likely it is we will be able to save people from the addiction. If one modality of addiction treatment can help just one person, that's a life saved. And that's huge. I mean, that's a huge repercussion, not just for that individual, but also for their family members as well. We talk about a lot of deaths and overdoses from addiction day in, day out, and we see the numbers continue to just increase. Now, for some people, this might appear to be just a statistic, but when it comes close to home, it really hits hard. This reminds me of, an experience I had some time back when I was a younger physician working in an ER. For any of you who has ever walked in an ER or visited one as a patient for that matter, you know how rowdy it can be. Now, during one of my shifts in the ER, I was busy attending to my work when a young patient was rolled in on a stretcher, accompanied by her family members. Now, for an ER, that's a pretty normal sight, right? And I really didn't think much of it at the time. I carried on doing what I was doing. About 10 minutes after this patient was rolled in, however, we heard a loud scream. There was pin drop silence in the ER. This was a scream of a mother in agony. Her daughter had just been pronounced dead. She was only 16, an only child, conceived after 8 years of trying to have a baby. She had overdosed on her mom's pain medications. Even as a physician, I was shaken, just thoroughly shaken to my core. So I can't even begin to imagine how the mom felt at that moment and how she coped with it. So I say this because addiction is real, the ramifications are huge, and we need to do everything possible we can to treat addiction, which will involve, like we talked about, individualized, personalized treatment, and also making that treatment comprehensive. So when I say comprehensive, I just mean multiple facets to addiction treatment. So we're talking detox, right? Of course, one has to accept that there is a problem and be motivated to take care of that problem, and then proceed to get help from a professional, which could be detox starting out depending on what the drug is, which could be inpatient addiction treatment or outpatient addiction treatment. And that would eventually translate to aftercare as well after the treatment has been done. Aftercare involves a lot of facets to it as well. So we're talking counseling to help you process maybe trauma which you've experienced in the past and hopefully get to the root cause of what's causing you addiction. We're talking about, in some cases, medication assisted treatment to help with cravings. We're talking about support groups, whether it be AA or NA or even just Facebook groups, which can be very helpful. We're talking about following up with your primary care provider to make sure physically you're healthy enough. You need to live in a healthy body. For those who end up making out provisions to treat their bodies right and live healthy, I just see them do well all the time. And that's one of the reasons why in addition to helping with addiction treatment and recovery, I'm also big on the wellness components as well.
Brilliant. Yeah, you've given a very comprehensive view of that there, which is brilliant, because I work in the field, so everything that you've just said there is exactly what the organisation that I work for. That's exactly all the support that we provide over here
Awesome.
in the UK. So I think that, you know, it's definitely mirrored in the US and the UK as to what is needed. And I think it's, you know, it's becoming more widely accepted now. I've seen quite a lot of quote unquote recovery influencers appearing now on social media, which is really, really quite cool, actually. I think, you know, one of them in particular is talking about, you know, the kind of like recovery is the new cool kind of thing because it's, you know, it's been kind of so cool for so many years to get fucked up and, you know, be a heroin addict and be you know, like the rock and roll stars that are heroin addicts and crack cocaine addicts and, you know, and whatever else. And now actually all these people are kind of getting old and and changing their lives, and it's becoming kind of like the new cool thing to do, which is awesome because it is an amazing way of life. And I'm sure that you've seen that. I'm sure that the people, imagine the hundreds, if not thousands of people that you've worked with, those that actually recover are few and far between in comparison to the number of people that you work with. So how does, you know, like, what does that look like for you? Like when you know, like, or how does that feel for you? Like when people come through and see you and get well and start to recover, how do you feel about that?
Oh, that's priceless. You know, when it comes to addiction treatment, there's a lot of stigma, not just with the general public, but also with healthcare professionals as well. And I think that's for several reasons. One of which is a lot of healthcare professionals don't get all the training they should get to help people who are struggling with addiction. Now, I think across the world, for the most part, that's changing, that's improving, and we need to do a little bit more there as well. But being able to see someone struggle, lose everything, and being able to help that one person go across over to the other side so that they begin to live a better life in recovery is just priceless. Now, does that happen all the time? No, it doesn't. We know that the recidivism rates, which is the relapse rates for addiction, can be quite high, but it's possible. It's doable. I've treated several people who are doing much better, living happier lives in recovery. And, you know, like you pointed out a while ago, we have a lot of people out there in the recovery field right now who are lending their voices to helping people recover. And I think we need a lot of voices in recovery because really what any one person says is not going to resonate with everybody. So the more voices we have, the better it's going to be because we will have different people resonate with different people who come on board to offer their services and their help, however that may be. Now, I'd also talked about wellness as a component to having people live better lives in recovery as well. And the reason I actually got into a certification in lifestyle medicine was because over the years, as I treated patients, I just saw a lot of people who came in with lifestyle changes, overall doing better, not just with the addictions, but also with their mental health. So right now, if you look at a lot of the studies, we know that exercise, for instance, helps with depression and anxiety and also helps with recovery as well. We know that sleep, for instance, is huge, just so huge. And that's one of the reasons why every single time a patient walks into my office, I'm going to ask about their sleep before they leave. That's how important it is. Now, studies have shown that people who are recovering from drugs and alcohol struggle with sleep issues 5 times as much as the public. 5 times. Just imagine that. And unfortunately, with sleep or with a lack of sleep, what happens is if you're not sleeping well enough, the chances of you relapsing are higher for several reasons. One of which is because people who don't sleep properly tend to become more impulsive, more irritable, struggle more with emotional regulation. So chances of relapses are high. So I usually will tell people to make sure they're getting enough sleep. And of course, if you're struggling with addiction to alcohol or drugs, you want to be very, very careful about sleep medications. Now, no doubt there's some sleep medications out there that people don't get addicted to, but there are some sleep medications which could become a problem on their own. So I'm usually big on sleep hygiene. And if you don't mind, Ren, I'd like to very quickly run through 10 sleep hygiene techniques that you could utilize and others could utilize as well just to get better sleep.
Yeah, go for it.
So number one is diet. Now, there's some foods that will inhibit your sleep. So foods high in sugar and refined fats, for instance, can inhibit your sleep. Spicy foods eaten late at night as well can inhibit your sleep. And again, you just want to avoid heavy meals shortly before bedtime. So the second thing is exercise. Studies have shown that exercise helps with sleep. Just exercising for 15 to 30 minutes a day is enough to give you the benefits of a better sleep at night. Now, the American Board of Lifestyle Medicine recommends about 150 minutes of exercise a week. Now, you can break that up however you want to break that up. And we're talking moderate exercise here. So you can do 30 minutes 5 days a week. You can break that up into 2 days or 3 days or every day as the case may be. But we will take a little bit of exercise over nothing. If all you're able to do every day is 10 minutes of some form of exercise, it's gonna be worth it. Now, the third thing is light. You want to try and get some sunlight in the daytime if you can. Now, I do understand that depending on where you live, that might not always be an option. But if you can, that's always helpful. And in the evening, you want to try and wind down by dimming the lights in the house so that your body begins to adjust to the fact that it's nighttime and it's time to go to bed, and your brain begins to release the natural chemicals in your brain called melatonin, which will help with sleep. Fourth point, electronic devices. We're in an era where it's all about the phones and computers and tablets right now, but you see these devices emit blue light. These can block the release of the sleep hormone called melatonin. So it's best to avoid using devices at least an hour to bedtime. And if you must, then activate the night mode. Activating the night mode isn't going to take away the blue light completely. So you're actually better off just staying away from the devices at least 1 to 2 hours before bedtime. Number 5, bedroom temperature. Your bedroom should be DCQ, dark, cold, and quiet. Because you see, at night, your body temperature drops to its lowest point. So studies have shown that if you're able to set your thermostat between about 60 to 70 degrees Fahrenheit, that helps with sleep. You also want to sleep in a quiet environment when you can. Now, I do understand sometimes your dog or the neighbor's dog might be barking, or you might live close to a major road and there's traffic going. You could use a white noise from a white noise machine or a phone app to drown that. 6, bedroom color. Yes, bedroom color can actually affect how you sleep, according to some studies out there. So you want to pick a color that makes you feel calm. And usually those are the lighter shades of white and gray and blue and green, as compared to painting your room, your bedroom, a dark purple color, for instance. And number 7, bedtime routine. I can't overemphasize this enough. Try to stick with a set time going to bed and waking up each night. That just helps your body adjust and gives you better sleep overall. Number 8, avoid alcohol before bed. That's a given, right? We should avoid. If you're struggling with drugs or alcohol, you should stay away completely. But for people who drink socially, there is a myth that alcohol helps with sleep. That's not exactly true. It could put you to sleep, but what happens is it fragments your sleep. It breaks up your sleep. You wake up more times. You don't go into REM sleep like you should. It becomes stimulating later on. So you'd have a lot of people pass out and then wake up after a few hours and not being able to go back to sleep. So you definitely want to cut that down if you're drinking at all. You also want to avoid tea and coffee. So that's number 9. The reason for this is because tea and coffee, in addition to being stimulants, are also diuretics. Diuretics are substances that make you pee. So you're going to end up waking up several times at night to go to the restroom, and then you get back to bed, and it might just be difficult to fall asleep. Last point here, Rain, number 10, wind down before bedtime. In this time and era, we have a lot of people working late into the night and working on their computers until it's time to fall asleep. But you want to try and do something relaxing, whatever that might be for you. It might be just taking a hot shower, taking a bath, reading a book, meditating, or some yoga. Now, if you can do these things, for a lot of people, they just find out that they're sleeping a lot better. And then, of course, if these are not working, then you can consider maybe meeting up with a professional for perhaps a sleep study or sleep medications to make sure you're getting proper sleep, because you need that to live healthy, to be able to regulate your emotions. And that will also help you live a better life in recovery.
So I'd like to just take a couple of minutes to introduce you to my new sponsor, Buds Life CBD patches. Now, Buds Life CBD patches are completely legal in the UK. They don't contain any of the THC or have any psychoactive effects of cannabis. So these have got no psychoactive properties at all, which means that they're not a drug. They're actually a supplement. So these CBD patches take all the goodness that cannabis has to offer, but you don't have to worry about getting high. And they're just a fantastic way of managing anxiety or pain without any of the psychoactive effects. So if other methods of CBD supplementation haven't worked for you, then buying CBD patches in the US or the UK could be the best alternative. Go to www.budslife.co.uk, or you can check them out at instagram.com/budslifecbduk or facebook.com/budslifecbduk. And they are available in 16 milligrams, 32 milligrams and 50 milligram patches. And if you'd like to get 15% off your first order, just use the promo code Life in Recovery. So that's 15% off your first order. Just use the promo code Life in Recovery.
Beautiful. Thank you very much for that. It was really comprehensive. I was going through each one in my mind, thinking yes and no and yes and no. I think the only thing that I don't do really at the moment is I don't have a regular bedtime, because I've got a 10-month-old baby, so I feed her and then I come downstairs and I do a bit of meditation, but I sometimes can get sucked into the apps and that kind of thing on my phone. So I think the phone needs to go off a little bit earlier.
Yep. But congratulations on the baby. Yes, obviously. I mean, that's a different kettle of fish altogether. If you have a baby, you have to be there for that baby. I have 3 kids myself, and I know what it was like with my 3 boys waking up at night and feed them and change them, and you have to do that. That's a phase, but at some point they're going to grow and you won't have to do that anymore.
Well, that's, I suppose, why it's most important to have that evening routine and to wind down, because historically I've been through kind of different phases in my recovery where I've been really, really good with that. Like I've switched everything off at 9 o'clock and then had a good hour and a half wind down and gone to bed at 10:30 every night, and I always feel a lot better. But as your life kind of chops and changes, you kind of adjust, don't you, to the way things are, and sometimes those kind of bad habits creep back in. But I mean, I'm very, very good with sleep. I can literally put my head on the pillow and I'm out like a light. So,
that's amazing. That's good for you.
But I do know, I totally relate to what you're saying. People, especially those in addiction, do tend to really, really struggle with sleep. So that's 10 really, really good points. Thank you for that. I wanted to ask you, so your passion for addiction medicine and lifestyle and well-being, where did that kind of originally come from? Is there any history in your family, or has it just been something that's kind of developed through your medical history?
Yeah, I think for me, no history in my family or with myself, but it's been as a medical professional, just going through my training and seeing a lot of people struggle, and just seeing that to start with, just don't have enough people to help people who are struggling with addiction. In addition to that, it's also the stigma I was seeing from not just the public, but also in the medical field as well. I mean, you hear of cases of, a patient coming into the ER and oh, it's that guy again. He was here just 2 days ago. He's always coming in intoxicated. So it was a case of wanting to help patients like that who were struggling, not necessarily because it was their fault that they're struggling with drugs or alcohol, because I don't think there's anybody who wakes up and says, oh geez, I want to have a struggle with drugs or alcohol. No, that's not the case. It's just the end of drinking or using drugs, and it spirals out of control very quickly for various reasons. So it's been stories like that and just a ton of other experiences I've had with patients who have come in really struggling. And then when you get to talk to them, you can actually see the human behind that struggle. And for me, that's very touching. And when you're able to help people like that get to a better place, that feeling is simply priceless, simply priceless. That drastic transformation that patients experience when they get better. It's for me, it's almost, it's just intoxicating seeing that, and makes my week each time I have a patient like that who has improved. And then also with addiction, I find the field of addiction also intriguing. We're talking about the brain here and how drugs and alcohol affect the neurochemistry of the brain. We know that yes, with addiction comes dopamine. In fact, I have once had someone describe dopamine as the save button in the brain. So what happens is you do something fun or something exciting, and your brain releases a little bit of dopamine. So let's take, for instance, let's say Ren, for instance, you like cheesecake, right? So you grab a cheesecake today, brain releases a little bit of dopamine and tells you, oh, okay, this is cool. So that's it. So at a later date, maybe 2 days, 3 days from now, you feel like a cheesecake because that's been saved, in your brain, and you feel like you want to get another one. What happens with drugs, however, is in addition to releasing dopamine in your brain, it releases an excess amount of dopamine. So each time you use, there's a ton of dopamine flooded into your brain, and then the brain now becomes accustomed to that. And over time, the brain struggles to assimilate, to produce as much dopamine as it should, which is where it becomes a struggle and people begin to crave drugs to get them to that high, because ordinarily things in the past that would give you that excitement and that joy no longer do, and all you want to do is just use. That's why you'd have people who are using drugs just abstain from everything else. I mean, they'll eat poorly, they will not rehydrate themselves, they will avoid other activities and friends, things they used to enjoy in the past, hobbies, and all of that goes through the window. And it's just the fixation on drugs. So it brings me to, a proper aftercare and a proper environment as well, because eventually when you get treated for your addiction, what we see very commonly is a lot of people just struggling to enjoy life because their brain chemistry has changed. One of the ways you can, of course, get your brain chemistry back to normal is, one, of course, stopping the drugs and then just trying to live healthier. Exercise has been proven to actually help you take your brain back to a semblance of normal. There are many studies out there that have actually shown that. So it's all about, as much as possible, getting rid of the addiction, getting the proper treatment, getting proper aftercare in place, and then also environment. I think this is something we should very quickly touch upon here. What I very commonly see in a lot of cases where people have gotten the proper addiction treatment, gotten out of treatment, and relapsed, one of the things I've very commonly seen is that they haven't worked on their environment. So they've gotten treatment and gotten back into the environment that precipitated or aggravated their drug use in the first place. Now, let me just very quickly, let me tell you a short story here about this place in Queenstown, New Zealand. That's where the first commercial bungee jumping took place in 1988. That location remains a huge tourist attraction even up till today for various reasons. One being because a lot of people want to go and bungee jump from this site, but also because a lot of other people want to go and watch. But here's what happens when people go to watch, right? They go over to the site, they're over there on a platform, and they're watching others being strapped on and jumping from this bridge known as the Kawarau Bridge and diving down 43 meters on a strap. I mean, that just sounds scary for me just thinking about it. But you have people watching this, and even if a lot of these people went there to watch, not to jump, over time, what happens is as they see others jump, they develop a confidence that this is possible, this is doable, I can do this. And a lot of those people who originally went to watch end up jumping themselves. They end up making the jump and enjoying it because they've been able to vicariously live off other people's experiences. So I say this because whom you have around you, what you see around you, the experiences you have around you play a huge role in what you as a person are going to do.
Yeah.
Same thing with support groups, right? People go into support groups and find this very helpful because you have people who are like-minded, who are aiming for the same goals and aspirations as yourself, and everybody coming in together and just offering support together just goes a long way in helping you go along with that ride.
Yeah. It's massively important, isn't it, to change? I mean, I ended up leaving the country. I left the UK and moved to Australia in my first year of recovery. And, you know, in hindsight, it was the best decision that I ever made because I think if I'd have stayed where I was, I'd have just had all the same triggers, all the same, you know, experiences going on, going to the same places, surrounded by alcohol and drugs. And I think that I would have picked up a drink again, you know, or I would have picked up a drug. And I hear, you know, it wasn't rehab, but it's the same when people go to rehab. It's like removing them from society for a short or longer period of time so that they can, you know, kind of reestablish themselves. And then most people that go back into their old environment will relapse. So yeah, it makes complete sense. It's again, it's something that, you know, that for those people that do go to rehab and those people that do go into support groups and fellowships and get people around them, it is about creating a completely new way of life. It's, you know, they say in 12 step, it's a bridge to normal living, and it is a bridge to normal living because what we were doing before wasn't normal, it was abnormal really. And that's kind of why I think that's why it's that, like, it's kind of considered so dirty addiction, because it's considered kind of abnormal in a way, isn't it?
That's right. That's right. Yeah, and you know, when it comes to addiction, obviously we can talk about this for days, right? And you know, another thing I'd like to point out, Ren, is the issue of trauma as it relates to addiction. Now, that's one really big component, and we can look at trauma in different ways, and we could write a book on trauma, you know, whether it's emotional, physical, sexual, you know, adverse childhood experiences. But again, that's another thing I will encourage people to do. You want to get a psychiatric evaluation if possible to find out if there's any ongoing mental health issues, whether it's anxiety, depression that could be aggravating your addiction, or whether you've had traumatic experiences in the past that you're still struggling with because you haven't processed it adequately. So getting to the root cause of those trauma will go a long way in just helping you feel better overall. I recall talking to someone in the past, and he said when he was 3 years old, his mom and dad separated, and then his mom remarried. And he said his first experience of witnessing trauma was when he was about 6. And he recalled being in his bedroom and hearing this loud argument from the kitchen. He walked into the kitchen and he saw his stepdad standing over his mom with a knife, with broken bottles all over the floor. He said that was an experience that never left him. And sadly, his stepfather eventually began to molest him sexually as well, from the age of about 7 to when he was in his just before his teens. So you can imagine someone having to deal with that, and what kind of experiences and implications that would have on him growing up. He said he grew up to be a very angry person, and he attributes this traumatic experience growing up to one of the reasons why he ended up being the way he is. So I think it's really important for us to take that into consideration and explore that and process that so we can move forward from it. And this reminds me of a movie I saw a while ago. It's a movie called Rocket Man. This was a movie on the life of musician Sir Elton John, and it highlighted the interplay of trauma, mental health, addiction, and recovery. And I think it's really worth a watch.
Yeah, it's a brilliant movie. That he's a shining light of recovery. He's Sir Elton John, definitely. And
For sure.
I saw that Sir Anthony Hopkins was 45 years in recovery as well recently. So yeah,
Amazing.
it is. It's brilliant. What would you say then, as just to kind of like round it off, because it's been really, really insightful, and thank you very much for your time. I just would like to know what would your advice be to anybody that is kind of struggling out there, or new to recovery, or wanting to make a change in their life? What would you suggest?
I think for those who are still struggling, I think the very first thing is acceptance and motivation. Of course, you have to realize that you have a problem and that problem needs to be taken care of. Now, there's a lot of professionals out there who can help, whether it's with your detox or your inpatient or outpatient treatment, or also just helping you with your aftercare. Get a counselor if you need to. Change your environment if you need to. Get some support if you need to. Change your friends. Join a support group, AA, the fellowships out there. Whatever it is you can do to live a better life, go for it. Eat healthier, exercise if you can. I would strongly recommend that for sure. Make sure you're sleeping better. Make sure you're more connected socially. Social connectedness is huge. Connect to other people around you, and also offer help to other people when you can. Someone recently told me about how he saved a friend's life. This is a friend whom he had slowly drifted apart from over several years. And one day he decided to just reach out. And all he did was send a text message asking how his friend was doing. That text message came in while his friend was writing a suicide note. His friend later told him this and told him that that singular text message saved his life. So when we talk about support, it doesn't always have to be something big. Sometimes it's just a simple text message. Check up on a friend, make a phone call, reach out to people. So I really think we need to bring all of this together and also keep an open mind when it comes to addiction. Whether it's the 12 steps, whether it's medication assisted treatment, whether it's other facets that can help you recover. Addiction treatment needs to be personalized to you because you are unique, you are different from everyone else, and it also has to be comprehensive.
Brilliant. Thank you very much for your time today. Where can we find you online if anybody wanted to get in touch?
Well, you can find me online at the Prime Recovery Portal, Portal. And I'm also coming up with my podcast as well. That should be launching in about 2 or 3 weeks' time. It's called Prime Recovery. So I'll be talking about addiction as a whole and offering free tips and resources to continue to help others out there. Like we said, Ren, we need a lot of people to just lend their voices to help this quagmire called addiction.
Beautiful. Well, thanks a lot, and you take care. It was nice to meet you, and good luck for the future.
Thank you. Very nice talking to you, Ren. I appreciate you inviting me over.
Thanks for listening, and if you've been affected by any of the issues discussed in the podcast, please see a range of mutual aid organisations in the show notes. Also, don't forget that you can support the Life in Recovery podcast by visiting patreon.com/Life in Recovery, and the podcast is sponsored by Dennis Berry Life Coaching. Go to www.dennisberry.com for your free consultation and use the code words Life in Recovery to get 10% off your next 3 sessions. Also, go to www.sugaraddiction.com/Life in Recovery and download your free copy of the Last Resort Sugar Detox Guide. And if you're really serious about quitting sugar, check out his 30-day Sugar Freedom Challenge whilst you are there. The podcast is also sponsored by Helios Recovery Services, the Recovery Coach Training Academy. Visit www.heliosrecovery.com to register for the Digital Recovery Coach Academy and Ethics Training, which is on January the 25th to January the 30th, 2021. And when you register, use the code words Life in Recovery to get 10% off the package price. And don't forget, you can get 15% off CBD patches to help you with stress and anxiety if you go to budslife.co.uk and use the promo code Life in Recovery. Peace and love, and goodbye for now.